Hello, ladies and gentlemen. You are most welcome to the online pregnancy school. I trust you are doing well. We thank God for another day and an opportunity to share ideas about how we can make pregnancy an enjoyable experience. I have been receiving questions about some of the topics that we have treated in the past, but also topics that we have not yet treated. And I told you some time past that we would be taking some of the questions from time to time to answer them. And so today we are going to look at one of such questions, and that is sex during pregnancy. If you are joining us for the first time today, my name is Dr. Linda Vanutu, and this is the Online Pregnancy School. I invite you to hit the subscribe button if you haven't done that yet, and also please turn on the notification bell. Copy that link and share with friends and family. Pregnancy should be an enjoyable experience. Unfortunately, there are so many challenges that pregnant women go through, but most of these can be addressed, including maternal mortality or death of a pregnant woman during pregnancy and even after she has delivered. Most of these are preventable, including deaths that occur in babies. So please continue to join us as we bring you the Online Pregnancy School. Today, I'm going to look at sex during pregnancy, a question that has bothered a lot of people, and we'll just look at some aspects of it. But please remember that when you go to the hospital for the antenatal clinic or to the pregnancy school and you have a question, ask the midwife or the doctor, whoever is attending to you. Please ask that person the question, and I'm sure the person will be very happy to answer that for you. So this program is not just for pregnant women as women alone, no. It's for both the males and the females, even if you are not yet married, or you are married but you are not yet pregnant. This is good for you, because if you know, you would be prepared for anything that can happen in the future. For those who are pregnant and watching us, I wish you all the best. My prayer is that God will see you through pregnancy and you have a successful delivery with a successful outcome. So let's look at sex during pregnancy. One of the questions people have asked is whether sex during pregnancy, especially the first 3 months of pregnancy, can cause miscarriage. And this is usually in people who have had miscarriages in the past or have heard stories about people who have had miscarriages and are concerned and want to know whether this can happen. We have had a session on miscarriages. So we have things that can cause miscarriages. And between 10 to 15% of pregnancies, especially in the first trimester, first 3 months of pregnancy, end in miscarriages. For some of them, the causes are not known, but there are also others that are because of the abnormalities that occur in these fetuses, that as the babies start to grow. When the egg and the sperm meet, they fuse together and start developing to become a human being. Somewhere along the line, this fertilized egg goes to implant inside the womb, and a whole lot of things can happen. Sometimes people are not even aware that they are pregnant. So they do all sorts of things, including taking some medications that are not prescribed for that period. So we can have things that can happen within that time, including what we call chromosomal abnormalities. And these abnormalities that occur inherent in that fertilized egg. So because that will not help this baby to develop and grow and be able to live outside the womb, these babies are miscarried. So that can happen. It could also be because the mother has an infection or has some medical condition that prevents the pregnancy from going on to term. So you find that these things can happen and can lead to miscarriage. There are also the factors that are to do with the baby. In addition to the chromosomal abnormalities, there might be other congenital abnormalities that would make it impossible for this baby to continue to develop and grow till the time that this child can be born. So the baby gets miscarried, or some other injuries, something else can happen that can lead to a miscarriage. But the question is, can sex during that time also contribute to miscarriages? And the answer is no. If there is no reason why sex should not take place during pregnancy, then that will not happen. And that means that sex during pregnancy is okay. A pregnant woman can have sex while she's still pregnant. But in the first 3 months of pregnancy, that is when there are so many things going on in this woman's life. She feels like vomiting in the morning. She cannot eat. She cannot tolerate the smell of different things. And she generally feels unhappy. So she doesn't even feel like doing that. Some may feel like doing that or having sex, but others may not feel like having sex. So some of them may want to stay away from that. Others, where they don't have any problem, they're allowed to do that. So if you talk to your midwife or your doctor, you'll be told if there's any reason why we should stay away from sex. But please, the first 3 months of pregnancy, if you are okay with it, sex can take place. Some people think that when a woman and the husband have sex while she's pregnant, the man's penis can hit the cervix, that's the tip of the womb, and then can disturb this baby and the baby can come out. But it hasn't been found to be true. It's not been found that that is what happens. So it is not a contributory factor to some of the things that lead to miscarriages in the first trimester. As pregnancy progresses, others would want to know, is it okay? In the second trimester, that's the second 3 months of pregnancy, you find that this is the time that the mother feels so well. She can eat well and she feels better than the first 3 months of pregnancy. And therefore, it is easier for her to accept to have sex during pregnancy. However, it is always important to listen to what the midwife or the doctor tells you. For some women, they have what we call incompetent cervix, where the cervix, instead of staying closed during pregnancy, open earlier than the time, and therefore any disturbances can bring the baby out. In that instance, because sex can produce what will let the uterus contract, it would be advised that she stays away from penetrative sex. The other thing is that there are some people who might be prone to a premature delivery. And prematurity in our part of the world, any baby who is born earlier than 37 weeks, that is a preterm baby. Now, there are some that are so young, the pregnancy doesn't go to a very long time before they deliver, sometimes before 28 weeks of pregnancy. And in fact, in some other places, they even bring it down to 20 weeks. So if it is found that there is that risk of this woman having a preterm delivery, then that may be advised that she stays off. And whilst we are doing that as care providers, we have to discuss this with the husband as well. So the two of them have to understand why it is not advisable for them to have sex when the woman is pregnant. In some instances, it might also be that the woman is bleeding. And if bleeding takes place while she's pregnant, then it could be because the placenta is lying very low down, and any disturbances that will push the cervix to open can lead to severe bleeding and she can lose the pregnancy. So it might be because of that. It might also be because of an infection, or because she's carrying twins and therefore the chances of having preterm delivery are also higher. So there are several reasons why a woman may be asked not to indulge in sex while she's pregnant. But please note that as a mother, as a woman, as a husband, you have the health workers available to advise you. So please do not say that I have heard that this is what happened to this woman, therefore it can happen to me, and you take that as what you would do. We don't advise that you do that. So please seek for medical care if you don't have all the information that you need for you to decide whether to do it or not. Ladies and gentlemen, if you have just joined us today, I'm talking about sex during pregnancy. Some people have asked whether sex during pregnancy can lead to miscarriage. We have had a session on miscarriages, and I would encourage you, if you haven't done that yet, to go back and listen to that session, and also subscribe so that you don't miss any of the sessions we bring your way. Turn on that notification bell so you'll be informed whenever we are coming up with another video. Now, as the pregnancy progresses, we get to the third trimester. And the third trimester is another challenging time for this pregnant woman, because the tummy has now grown bigger. She feels hot. She feels uncomfortable. Sometimes breathing becomes a problem. And if she has any other condition, then that is also aggravating the whole situation of uncomfortable state that she's in. So she might again not want to do that. And even with that big tummy, you as a husband, you cannot lie on that tummy, because it will not be advisable for her. If she lies on her back, it will be a problem for her. So it is also advisable that you seek medical care. But if she's okay, she feels comfortable, and she's for it, then you can have sex with her. But then there are different positions that can be prescribed for you, the couple, to have sex if that is okay for you, if there are no contraindications. So please note that the only time you are to stay away is when your midwife or your medical doctor has told you that it is not advisable for you to have sex, because it can lead to complications, or it can lead to the loss of that pregnancy. That is the time. But otherwise, if you are comfortable, both of you feel okay with it, please, it is not, sex is not contraindicated during pregnancy, unless there's a medical reason why, or there's some other reasons why you can share with the medical doctors, and they will advise you as to what to do. Now, in terms of what it does, what sex will do for the couple, it helps them to stay connected. You know, it is something that binds the two of them together. And so it helps them to stay connected. The other thing it does is that sex can release some hormones, can release some other things that kind of give some pleasurable feeling to the people involved. And so for the mother and also for the baby, because you see, as somebody is pregnant, whatever she feels is transmitted to the baby. If she feels sad, the baby will feel it. If she feels happy, the baby will feel it. So because if she's okay mentally and psychologically and physically and everything, and she engages in sex, and it gives her that pleasure, then that can be transmitted also to the baby. And then for some women, when they are pregnant, they look at themselves, they look at the body. Now she's in quotes out of shape. That's what she thinks. And she might feel unattractive. So if the husband is still interested in having sex with her, then that gives her that encouragement and that fulfillment that I am still attractive to my husband. So that also helps her to experience pregnancy as a joyful thing. But if she feels she's too big, or she looks at herself in the mirror and she sees her face is bloated, her nose, her hands and all that, and she feels she's not attractive anymore, and the husband also stays away without any medical reason, then that makes her unhappy. So that is one thing that it can do for them. In some cultures, you find that because, and it's interesting, because of the effect that the sperms have on the uterus, it can cause contraction. When a woman gets into labor, she's asked to have sex before she goes to deliver. And this is interesting. I'm sure from their own observations, they found that this is what happens. Probably they see that it makes it easier for them when they do that. As a woman goes into labor and she has had sex, then the contractions continue, becomes okay, regularized, and then she can deliver quickly. Maybe that is what they have found. But scientifically, it's also known that the prostaglandins will have an effect on the uterus. And so that also happens. But when you are in labor, it can be very painful. Now, even if you haven't been given any medical reason not to have sex, and therefore you engage in sex whilst you are pregnant, and you have some observations, please report to the hospital. One of them is if you have so much pain that it's unbearable and it lasts more than a day. Sometimes they say 2 days. But if it's so painful, then please report to the hospital. If you find that you were not bleeding before, but now you start bleeding after sex, please do not stay at home. Because bleeding in pregnancy, the early part of pregnancy, when the fertilized egg is getting implanted into the womb, that one there could be what we call implantation bleeding, but that is very minimal. After that, there should be no bleeding. So if you find that you did not have any bleeding, but you have sex and you start bleeding, please report to the hospital. It might be that the placenta is low, or it might be some other reason. It could even be that you have a cut somewhere that has to be fixed. So please, if you find that this is happening to you, kindly go to the hospital. If you also find that you have an infection after sex, please go to the hospital. Even though there is a plug, something that stops the cervix, the tip of the cervix, there's something that is there that helps to prevent infection from going into the baby. But we have seen instances where babies have been born with infections. So if you find that you have any infection, you have a discharge that is smelly, or you are itching, or there's anything that is different from what you know, then please report to the hospital. If you also find that after you have sex, you feel anything that was not there before, please do not stay at home. Kindly go to the hospital so that it can be looked at properly for you and the appropriate treatment would be given. Ladies and gentlemen, if you have just joined me today, I am talking about sex during pregnancy. And people want to know whether it can lead to miscarriage. I've shared with you in previous videos what is miscarriage and what are some of the things that can contribute to a miscarriage. Now, the bottom line is that if you don't have any medical reason why you should not have sex, then sex can be prescribed. It is allowed during pregnancy for several reasons. The first trimester, the first 3 months of life, you can have sex. The second trimester, you can have sex. The third trimester, you can have sex. And I say that even for some people, when the women go into labor, they have sex before they go to deliver. Interesting. So you can have sex. So for the husbands, the fact that this woman can have sex during pregnancy doesn't mean that it is just anyhow. No. There are some positions that she may not be comfortable with, and it's even not advisable. But in the first 3 months of pregnancy, when the womb hasn't become big and it is still inside, you can hardly see it. And even probably the first part of the second trimester, then the normal routine way of having sex with a woman on her back can be practiced if she feels comfortable. As the pregnancy progresses, then that becomes a challenge and is not advisable. So now she can lie on her back and you are also at the back. So that is also another way. There are different ways that people can enjoy their sex life when the woman is pregnant. Or the man can be the one on the back and the woman will be on top. But whatever you are doing, please just be mindful of the fact that, yes, it is allowed, but if for any reason you find that there's something wrong, please go to the hospital. I always say this, it is better to go to the hospital than to try and solve the problem at home without knowing what is happening. If she starts bleeding, if she starts having anything that is abnormal. Another thing, if the pregnancy has gone on for some time and there should be no leaking of water. But if you find that she starts leaking water, that is not the time to have sex, please, because you can introduce infection. The baby lies in water and there's a sheet around this baby. If the woman starts losing water, it means that there's a hole that has happened in that sac. And therefore, if you do anything that travels inside, if there's any infection, then she can have an infection traveling into the womb, and that will not be good for her. So please be mindful of that. That is not the time to have sex. If she starts having contractions when it is not yet her time, it is not yet time to have sex, please. It is time to stay away from that. So there are various things that you can look out for. 1, bleeding. 2, if she's losing water. 3, if she has pain. 4, if she has any other reason why this should not happen, then please, that is not the time to continue to have sex. Report to the hospital, let them check up, and then if everything is okay, you'll be told that you can resume. If there's something wrong, you can now stay off until she has delivered. And later on, you can do that. So please let us take note. The question was, can sex lead to miscarriages in the first trimester? But I've taken the time to just brush the surface of what can happen in the various trimesters for you. In the last trimester, that's the 3rd trimester, when she's preparing to deliver, that time, I've told you that she feels uncomfortable and therefore she may not want to do that. But if there's nothing wrong, still sex can be enjoyed during that time. And it is between the two of you to look at what works best for you. And as I said, there are different positions that you can use to have sex. It's not about this woman lying on her back, please. When the tummy is big, you cannot do that because you don't want to push anything on the tummy. It will affect her breathing. It will affect the blood supply to the baby, to the mother herself. She can become short of breath, and that is not good because you don't want to have an emergency on your hand as you do that. So please take note. And after she has delivered, maybe we'll just add a little bit. After she has delivered, allow her to recover from her pregnancy. Pregnancy can be very, very challenging with all the emotional things that she goes through, with all the hormonal changes, with all the poor eating habit, poor sleeping time, all these things. So we have to be careful. And even while she's still pregnant, because sometimes they have these horrible dreams and they cannot sleep well and all that, even though there might not be a medical reason for staying away from sex. If she slept poorly in the night, that could be a very big challenge for her. So please, as a husband, be supportive. Just have conversation with your wife and see when it's okay for you to have sex so that you can continue your bonding while she's pregnant and let her feel well. She also lets you feel well. I hope that helps. So ladies and gentlemen, today we looked at sex during pregnancy. I hope you have learned something new, that it is allowed, it is not contraindicated unless there is a medical reason for that. And that has to be discussed with the midwife or the doctor who is seeing you. If you don't understand, you have any questions, please don't hesitate. Ask them. Ask the midwife, ask the doctor. When you go for the pregnancy school, ask questions. When you go for the antenatal, ask questions. And you can also read about it. So please take note and share with friends and family. Until I come your way again with another interesting topic to answer some of the other questions that we have received. Stay blessed. My name, once again, is Dr. Linda Vanutu, and it is always a pleasure to come your way with the online pregnancy school. See you in my next video. Bye for now.